Thank you for joining us for our short video series on preventing injuries when lifting. This is a topic that's timely at this time of year, as we started seeing more people in the clinic complaining of low back, knee, shoulder pain after doing repetitive tasks in the garden. But these are also the type of injuries that can occur just over the course of the day from what we usually will do. So very timely right now. And who are we? We are a team of physiotherapists, massage therapists, and naturopathic doctors working at Family Physiotherapy in Thornhill. We treat the communities of Thornhill, Markham, and Vaughan. We've had experience working in spinal injuries, work-related injuries, sports-related injuries, sometimes the simple and sometimes the complex non-resolving. And that's because our therapists have over 40 years of clinical experience in trying to not just treat the pain, but also to find the underlying problems that are preventing you from reaching your fitness goals. So starting off with a little bit of true or false, you should get help to lift heavy objects. I think that one is very obvious that it's true. The heavier that an object is, the more muscle mass is required to actually lift it. These muscles typically will involve not just the muscles of our legs and our shoulders, but also those of our spine. The larger the amount of muscle contraction that's occurring, the more compression is applied, and if you're already in a vulnerable position, it can increase the chance of injury. Next, true or false, you should keep the load close to your body when you're lifting it. I think the answer to that one is pretty obvious. It's true. If your object is not close to your body, if it's further away from you, there's a larger lever load that is placed on the low back. More muscle effort is required, and again, it increases the chance of sustaining a repetitive strain type of injury. And finally, you should always bend your knees when lifting. So this one's not always true, so I'm going to throw that one in there as a false. There's a lot of factors that do come into play when we're choosing the type of lifting strategy that we're going to be using. So here we have a very commonly seen visual. The gentleman on the left has chosen not to bend his knees. He's picking up a load from close to the ground. His arms are straight out and he's got a lot of the movement occurring through his back. Looks like he's in some discomfort having done so. What this does is, by not bending the knees, we're not getting closer to the load. And so the gentleman on the right now is closer to the load. He's closer, he got closer by bending through his knees, keeping his body in a relatively neutral posture. And that's great if the task was to lift an object off the ground. But that's not always what we're going to be accomplishing. And here we see another scenario of a caregiver helping somebody out of a wheelchair. If her strategy was to get the person strictly vertical, then a similar type of strategy, bending through the knees, would be a good type of strategy. However, if her goal is to get this person towards the bend, just going down into a squat is not going to really help her transfer the person towards the bed. She would be ideal for getting them vertical, but would now have to pivot through her knees and through her back. So we do have to take into account what we are actually trying to accomplish. The scenario number 2, if you're trying to lift a heavy object straight off the ground, going into a full squat is not going to put you into a very stable position. Your knees are in full range of motion. They're not able to provide as much power to come up off of the ground, and it can increase the chance of now being more vulnerable to perturbations that occur. So if you were to slip, if you were to move, or just not being able to handle the load that you'd like to handle. So it's really important to make sure that you put yourself in a strong and stable position. Know what it is that you want to lift and know what you want to do with it. Lifts don't have to occur in just one stage. They can be planned out. Step 2 can be to get the object off the ground, and stage 2 could be to carry it. Stage 3 could be to position it somewhere else. Try to get as close to the load as possible and to give yourself a stable base. Often going down into a single kneeling position can allow you to do that while still maintaining one leg into a strong position. Arrange your base of support so that you can move through your legs and move through your hips, not twisting through your spine. So thank you for joining us for this, again, very brief video presentation. If you've experienced problems with lifting, again, the ideal situation would be to get help if needed, but often small injuries can be left over the course of years and can start to interfere with activities of daily living. If you've tried strategies like those that we've described and you find that they don't work for you, then we can always help you to find a strategy that does work or to address some of the underlying factors that are preventing good strategies from being good strategies for you.